Just to let everybody know that the sound probably does work, but I think it's because nobody is speaking, unless that I'm mistaken, because I saw a message in the chat.
So whenever you want, Jan.
Okay. A very welcome to everybody this morning to join this open market consultation. We have an interesting agenda to introduce the project, also to listen to some of you with potential solutions, questions. I will start with a little bit of introduction of ZAS, Hospital at the River. We are excited to participate in this project. And I'll give you a little bit of background of our organization and also a deep dive with some more information on water treatment within our hospital. The colleagues from the project will also give some information on Theresa itself, on the legal side, more the commercial side, and also some expectations. And we also have some pitches from some of you that we are excited to listen to. The house rules, Barton, I would leave to you to go through them because you have more expertise in this one before I introduce a little bit more myself and our organization.
Okay, perfect. As you can see, in this event will be recorded for so the participants who don't wish to appear kindly request to switch off their camera and use the chat function. We also have a Q&A feature in the Teams, so you can write your questions and they will be answered in that feature or at the end of the event, and will be published in our website. Also, the recording and the presentation will be available in the Theresa website. And of course, the list of the participants who are here in this event, you can be sure that it won't be disseminated. Okay.
Thank you, Bartos. So if you look at hospital at the stream, it's a little bit free translation. It's in Dutch, ziekenhuis aan de stroom. It actually is an exciting name linked to this project because for us in Antwerp, in the Antwerp region where we're located in Belgium, the hospital is an example of what we are aiming for as an organization. It's continuously in movement. What we also are aiming as an organization, our hospitals, we need to adapt ourselves to circumstances outside the walls of our hospitals continuously. It is kind of a life vein of the city, the stream. That's also what we would like to offer for our patients, is to give perspective, to cure them, but also work on their health within the region. And I think that's where we also would like to take responsibility on our water treatment, because we have a huge impact on this stream that you see in the picture, because we are aware that we are producing a lot of waste which is coming into the water. And that's why if you go to the next slide, and I think there's a small animation, but you can go through the next one because we will share this. That's also at board level. I'm responsible for quality, innovation, sustainability, and lean, and trying to drive this agenda. But also our share board of the directors or the general board and the mayor of the Antwerp city, Els van Doesburg, is also much in favor of investing in this type of innovation, investing in sustainability, because she often refers to the goal that our hospitals are the James Bonds of the hospitals. Looking at innovations and how they can trigger sustainability. And that's also why we are so focusing so much on this project too. We are looking for innovations within this domain of water treatment. A little bit about myself, but I will not bore you too much. If you look at movies, my passion for sustainability was already there when I was a youngster in the years 80s. In the 80s, I think most of you recognize this car, the DeLorean. When the professor puts a banana in there, I was amazed that on biofuel, this car could travel through time. And I think throughout that years, but I only did know that later on, we had the Brundtland definition of sustainability. And I already had a lot of interest from that perspective, and I'm very happy right now that together, if you go to the next slide, with Annelies and Gwen, that we have the privilege to determine, but also to facilitate our sustainability agenda within ZAS or hospitals. So Gwen is a lean coach. Gwen, and thanks for preparing everything and also your engagement in this project. And Annelies within my team is the sustainability manager, who is not only driving the environmental angle, but also the social angle and the governance angle, if you think about the ESG framework, which I will refer to in a minute. So with the three of us, we are participating in this project. And to give you a little bit of insights of our organization, you can, Bartos, go to the next slide. We are fully aware, and you have to click a little bit, Bartos, to show everything. We are fully aware that we have a lot of impact as organizations. Our organization, we have about 18 locations and about 1,000 employees amongst 1,000 doctors within our network of hospitals. And with all those licensed beds that we have, those admissions and also those surgeries that you can see there, we are producing a lot of waste. We're fully aware of that. That's why we're also willing to invest in projects like this. And to just give you an idea of the size, we are delivering one class of children every day. Yeah, 8,000 birds. That's also what we're proud of. So just to give you some idea, if you go to the next slide, you can see that we are spread amongst that river that I was talking about, the Schelde. These are all our locations. We have 14 hospital campuses from small to large hospitals. And if you click, we also have some focused clinics, outpatient clinics, one medical center. And then in the center, we have our ICT department at SAS Plantin in the middle of the slide, and we also have some logistical locations. So we can have an impact for sure with this project, but on the other hand, it also makes it more complex because every campus has its own identity. So we're not looking for general solutions. So the solutions that are provided needs to fit the different identities of the campuses. And that's definitely something we can work on together. It is a huge opportunity, but on the other hand, take into account that complexity that we need to deal with. If you go to the next slide, and it's more for your reference, you have some pictures of every of those campuses, where they're located. And I would like to also go a little bit deeper on our strategic goals and what we're focusing on as ZAS. So if you click, Bartos, you can see on this slide, our goal, and it's also triggered by the government, is that of all those locations, our main goal is that we still provide care close to the patient's home. Our city hospital, it's very popular because you can easily step in. You're not limited by traffic, and we offer general care. Besides that, we have specialized and high-tech healthcare in those focused clinics, but also often dedicated equipment, which also has some special impact on, for instance, water treatment. To give you an idea, think about dialysis equipment installations that some special water treatment is needed. And we have about 38 medical specialties within our network. Going further, Bartos, I would like to share with you some of our strategic goals, because if you look today, every day you can focus on something else. There's so much going on, and I think that's a huge challenge for us. Where are we going to focus on as an organization? What are our strategic goals? because my CFO, financial director, would probably not promote a project on World Horse Day. And I have definitely nothing against horses, but we would like to see what we're investing, if we're investing, that it has an impact on our organization and also on society. So therefore, we did define 4 strategic goals on the next slide for 2026 and the upcoming years. And you see at the bottom left, the attention for our people to promote innovation, entrepreneurship, critical. We have to realize still our merge. The ZAS organization that I did show you is a combination of a former 2 former hospital networks, and we're still working on harmonizing processes amongst that organization. To give you an idea, we have 23,000 procedures that we need to rationalize from history. The third one is also in collaboration with the government in Belgium. We need to rationalize our footprint of campuses. So determine very direct and straight, where are we going to offer general care, where are we going to offer specialized care, resulting in many movements of departments, combination of departments. That's the third goal. And then our CFO, of course, financial director, also did determine a financial goal. That are the 4 ones as foundation. And on top of them, the 5th one, and then we're coming to also this project. You can see continuous focus on sustainability, innovation, quality, and process improvement, the topic that my department, Annelies, Gwen, are also supporting. So that is our compass for 2026 and the upcoming years. I know it's high level, but just to give you an idea from all those different initiatives, what is our focus? And to the right, you can see we're all doing this, taking into account our values, our 4 core values, being progressive, connecting ZAS with the environment, with our patients, with their families, with our employees, respectful and warm. So how does this translate in our sustainability strategy to finalize? Then you can click, Bartos, please, again. We have determined, based upon the ESG framework, environment, social governance, we have translated this in our 3 priorities: care for the planet, care for people, and a strong organization. And we have 3 sub-goals for all of those 3 high-level goals. So if we look at what does sustainability means for ZAS, we have those 3 areas we're working on with 3 sub-teams or sub-goals, and then about 400 initiatives that we're rationalizing at this moment. But this project is one of our key initiatives because it has an impact, like you can see to the left, on the 3 main priorities. So I think care for the planet is obvious. And I'm not sure if you're aware of it, but Flanders is one of the most vulnerable regions in Europe. If you look in the future in terms of drinking water supply, to continuously make sure that this will be possible in the future. I already mentioned that as us, we have an impact as hospitals on our drinking water, on wastewater. So we want to make sure that even micro pollution, we tackle that into the future. And I think this project is focusing on that. And water is, of course, the new gold. We must handle it carefully, looking at strong organization. We also look at the cost quality as a combination. So this is to give you a flavor. We have 5 strategic goals. Sustainability is one of them. And within sustainability, we have these sub-goals, which we can link directly to this project. So I hope this did give you a little bit of flavor of who we are as ZAS, looking at our size, looking at our locations, looking at our ambitions. And I'm quite excited, very excited to see how this project and how all of you can help us on the challenges that you can see on this slide. With that said, Bartos, I would like to hand it over again to you, and I think I will come back with some more details on water treatment within ZAS later on in this presentation.
Okay, thank you, Jan. So now it's time for Navarra Biomed to make an explanation of what Teresa is aiming for. So I don't know if John, do you want me to share or do you want to share?
I will do it.
Okay, perfect.
Yeah. Can you see it? Can you see my screen?
Yes,
Yeah.
but it's
We see it in presentation mode, John. So you probably need to press on the 3 bullets.
You don't. Because. Second. Are you seeing it now? Better?
Yeah, now it's working.
Yes, perfect.
Working? Okay. Thank you. Yeah. Well, here in this, first of all, I'm Johnny Zaguirre, and I'm speaking on behalf of Fundación Miguel Servet Navarra Biomed, which we coordinate this project. Okay, and we want to talk to you a little bit about what is Theresa and what is it about. Okay, so the project Theresa has a surname which is PCP. Okay, it's Theresa PCP, which means that it is an European pre-commercial procurement project. Okay, in this project, these public organizations, for example, the procurers collaborate with the market to develop an innovative solution and to test it also. And that, but the thing here is that these innovations are not yet available in the market. Okay, so we, Teresa, will invest 2.9 million through this process of the PCP, through the different phases that we will explain later, and we will allocate this budget to different companies, to different suppliers in different phases of the project. Okay, we have a big challenge. Okay. It has already been introduced before, but the hospitals have an issue with the water that we release, because many emergent contaminants, different substances are released in the wastewater of our hospitals that cause harm to the environment. Among these contaminants, we can talk about pharmaceuticals, different pathogens that have strong resistances to antimicrobials, different drugs like cancer drugs, contrast agents, okay, used for diagnosis, and different elements of antibiotic resistance, antibiotics themselves, and so on. The thing here is that conventional treatment plants cannot remove all these substances altogether, okay? And in many cases, these contaminants reach river soils and all the environment change, so they end up in our food, in our drinking water. So this is an increase in environmental concern across Europe, and we are trying to help to tackle it. Okay. Among all these contaminants, we have addressed some of them, which makes sense in our opinion, because and we have tried to develop or work with companies or suppliers to try to develop solutions to tackle them. So the contaminants that we are addressing in these projects are cytostatics, X-ray contrast agents, and antibiotics, and also antibiotic-resistant bacteria and genes. Okay. for the definition of these contaminants, okay, we have been working since the beginning of the project all together with different hospitals to try to reach a consensus about which of these contaminants can we try to eliminate or at least reduce. Okay, the selection of these contaminants is really widely developed in our questionnaire that we have, that we will explain later on. But the selection has been made regarding the clinical impact of these drugs or elements. Okay, their impact in the environment, and also the wide use of them. I mean, for example, we have selected a lot of really I would say dangerous drugs that are very widely used in our hospitals, and in some other cases we have selected some other elements or drugs that are used in a lower amount, but at the same time have a very high impact on the environment. So we have used different criteria. Okay, we have reached or tried to reach an agreement among hospitals, and then we are asking to the suppliers if this wish list, okay, makes sense. Is it possible to address with the different technologies that they develop, and maybe we could fine tune it in the future to try to address all the contaminants that could be tackled through the different solutions. The goal of the project at the end is to try to develop a modular, interoperable and adaptable technology, okay, that should try to target all the priority contaminant groups, okay, and it has also it has to address also and demonstrate that its technical feasibility, cost effectiveness, and readiness for integration into the real world infrastructures. At the end, we need a technology that removes these contaminants very close to the source of their production, or at least where they are being thrown into the water, okay, because they will be present in a higher concentration. And we want to do this before discharging our wastewater into the municipal circuit, okay? For this reason, we have a very strong group of hospitals that are working together. As I said before, we have been working on the definition of the contaminants, and we have been working on the definition of the constraints and limitations of an operation regarding its operational and infrastructure conditions of the hospitals. So this group of hospitals is formed by hospitals from very different countries all across Europe. Okay, we have SAS from Belgium. We have Maastricht Hospital, University Hospital from the Netherlands. We have hospital WSS from Olsztyn, Poland. We have PER from Estonia, and we have 3 Spanish hospitals: Hospital Virgen de la Macarena from Sevilla, Consorcio Hospitalari de Vic from Catalonia, and here Hospital Universitario de Navarra from Navarra. But we are not alone, okay? So we are working along with different partners that have the knowledge about the environmental, legal compliance, okay? They have the tools, they have the contacts, they have as I said before, the expertise. So we think that we have a very strong team along Silo, Healthcare Without Harm, Corvers, Take Biomed, Sanin, and Yetu. That we have to try to form a very strong team. We have tried to form a team that can address all the gaps that the hospitals have regarding the development of this solution, and we are working since September very hard to try to talk to the market, to address the market, and to speak with them in order to carry out a very good and efficient PCP process. Okay, so that would be it. This is Theresa PCP, and of course, any other question that you may have, you can address it via the questions and answers section, and I will answer them at the end of the session.
I think this is my cue, correct? For the presentation. Yes. Great, just give me a sec because I'm also preparing it. Here we are. Just let me know if you're seeing my screen. It should be coming anytime now. You're seeing it, right? But it's not in presentation mode. Are you seeing it now in presentation mode?
Yep. Yeah, now we do see it in presentation mode, Annabelle. Yeah.
Okay, great. So I will just start. Just before we start, real quick, my name is Annabelle Peiró. I'm a legal consultant at Corvers, and we are supporting Theresa PCP when it comes to the actual implementation of the pre-commercial procurement. Also, before start, I would really like to thank you all for your interest in Theresa PCP and for your participation in these open market consultation events. We really appreciate it. In this part of the presentation, what I want to do is to give you a brief introduction to what pre-commercial procurement is, so what Theresa PCP is all about, and its legal framework. I'm saying small, short presentation because this was already presented in several events before. So if you are interested in this and you have more questions, I would highly encourage you to check that presentation. You can, of course, also ask questions in the chat. But this part of the presentation is going to be a bit short because I really want to focus on the intellectual property rights allocation, a key aspect in a pre-commercial procurement, and then on confidentiality issues. So without further ado, let me just jump right into the pre-commercial procurement and its legal framework so that we understand what we are all talking about. What is a pre-commercial procurement? Well, in a pre-commercial procurement, what happens is that we have several public buyers, in this particular case because it's a joint procurement, that have a common need. And when they go to the market to buy a solution to address that need, they realize that the market still has no answer. There is still no solution. So the mindset changed, and what we decide we need is to buy R&D services, research and development services, to develop that solution that we need. That's a pre-commercial procurement. How does this work in practice? Well, in practice, we have a competitive phased approach, which means that, and now I am bringing it back to Theresa pre-commercial procurement, in the first, we are going to divide this procurement in different phases, and these phases are closely linked to the technology readiness level of the solution. Quick disclaimer, technology readiness level is a scale that indicates the maturity of the solution, right? So the lower the technology readiness level, the more R&D is necessary for the solution to make it to the market. And conversely, if you see a high technology readiness level, 8, for example, it means that the solution is really close to the market and just might need minor adaptation. Tier L9 implies that the solution is already widespread on the market. This is just in very simple terms, okay, just for us to understand. So in Theresa PCP, what we will have is a phase 1 in which we will invite several competitors, ideally 5, and we will have these 5 contractors designing a solution. Once this phase is over, the successful ones, the ones that develop, that design a promising solution, will be invited to submit a proposal for phase 2. And then 3 of them, 3 contractors, will be selected to develop a prototype based on their solution design. As you can see here, we are decreasing the number of competitors in each of the phases, and we are increasing the technology readiness level of the solution as the phases progress. Phase 3, same idea. Best contractors from phase 2 will be invited to submit a proposal for phase 3, and 2 selected ones will actually test the prototype that they developed in phase 2 in a real-life environment, in particular in 4 hospitals. At the end of this phase, we will have a working prototype. As you can see, the technology readiness level is very high, which means that the solution is really close to the market. Here, pre-commercial procurement stops, right? So Theresa PCP will stop once we have a working prototype. And if we want to purchase commercial volumes of the solution, then we will need to launch another procurement procedure. Normally, this is done under a public procurement of innovative solutions approach, but that's after the pre-commercial procurement. It doesn't affect us now, okay? Another very, very important characteristic and the goal of today's presentation is the risk-benefits sharing approach. This sounds very fancy, but what does this mean? Well, in practice, this means that in a pre-commercial procurement, the contractors, you as contractors, will be keeping the ownership of the intellectual property rights of the solution that you develop. And in exchange of a lower price paid, because of course we are not keeping the intellectual property rights, the public buyers receive a license to use the solution up until the point it was developed. Let me dwell into that in the next part of the presentation. What do I mean when I am saying that contractors keep the ownership of the intellectual property right? Well, it means that, of course, if you're using background intellectual property rights, that belongs to you, no questions asked about that. The intellectual property rights that are linked to the solution that you developed will also belong to you, which in practice means that once the PCP is over, you can keep further developing it because it's yours. Of course, having this right, having this property comes with certain obligations. You have to inform us of results that can be protected, of the measures that you are taking to protect them, because you are mandated to protect those rights. You also have a mandatory obligation to commercialize. This is all duly explained in the tender documents, just for you to know, explaining also for how long. So normally, for example, the commercialization obligation is for 4 years, because we think that 4 years is a reasonable period for you to commercialize. Same for protection. So you have to inform us in 30 days. And in 30 days, we can have discussions on how you're going to do that, how it's going to be, etc., etc. This is very important because, as I was saying, the public buyers have a right to use the solution. So, of course, we are invested in this and we are interested that these results are protected. If for whichever reason it is you decide not to protect them or not to commercialize, the public buyers have a right to ask you why not, to have a discussion about it, and then they have also a right to protect the intellectual property rights themselves for themselves and to further commercialize the solution for themselves or using a third party. Of course, if you are conducting everything that you can in order to commercialize, for example, but for whichever reason it doesn't work, this can be discussed, okay? It's not written in stone, but the idea is that you do commercialize. Very important because we are always asked. Public buyers have a right to use the solution up until the point it was developed during the pre-commercial procurement, meaning that we have a right to use the solution up until the point you make it in the PCP. If you made it until PCP phase 2, that's where our rights stop. If you made it until PCP phase 3, that's where our rights stop. If we want to purchase commercial volumes of the solution, that's a whole another story, and we have to discuss then the intellectual property rights. You will keep them, and then we will have to pay a price, just for you to know, okay? We do have a specific right, which is the right to ask you to give licenses, non-exclusive licenses, to third parties. But these licenses are not for free. They are under fair, reasonable, and non-discriminatory conditions, meaning that you have the right to negotiate. And also important for you to know, the license that you are giving the public buyers group during the PCP is irrevocable, royalty-free, non-exclusive, non-commercial, okay? So just for you to understand. Also, if you don't understand something about this because it's complex, ask as many questions as you want in the chat, but please know that this is thoroughly explained in the tender documents. Once we publish them, which will happen in April, if I'm not mistaken, you will have the request for tender, a generic explanation like the one that I am giving now. And then in the framework agreement, you will have a full clause explaining the rights and obligations of the parties. One thing that I am going to ask you to do is, if you're interested in Theresa PCP, please follow us, because when we are publishing the tender documents, we will duly inform you. We will also disseminate this. You will be able to download the tender documents, and you will be able to check all the clauses and conditions, including these ones about intellectual property rights. And if you have questions, if you think that something is not aligned, whatever it is, you have the right to ask questions and clarifications, and we can address them and even further modify the tender documents. So please follow this up if, of course, if Theresa PCP is interesting to you, because we are more than open to your questions, to your request, and to clarify if necessary, okay? So that's another thing. In the last part, what I wanted to explain to you a little bit is the confidentiality aspects of pre-commercial procurement. As you know, we are now conducting the open market consultations, and you can actually find confidentiality in all the phases of a PCP, including the preparatory phases, such as the open market consultation. So you are going to see confidentiality mentioned in all our preparatory documents, but you are going to see also confidentiality disclaimers during the submission of your tender and during the execution of the contract. So let's see these three different phases: the preparatory phases, open market consultation, submission, and tender execution. In the open market consultation, you know that we need to achieve this difficult, because it's difficult, balance between transparency and confidentiality, in the sense that, of course, everything that is said during this open market consultation, we need to share it with the market, with just one goal: to ensure that everybody is on the same level playing field when they submit a tender. So, of course, this is the preparatory phase, but once we are publishing the tender, everybody should have the same information. There cannot be no discrimination because somebody got more information for participating here. That means that if you submit a question to us, we are going to anonymize it, so nobody is going to know who asked, but we have to publish it. We have to give all the information that we can so that the whole market is aware of where are we standing, right? And the reason behind this is that we need to prevent any competitive advantage. Again, this careful balance between confidentiality and transparency. And the goal is to comply with proportionality and non-discrimination. That's why also private or bilateral clarifications are not permitted. Please don't make this difficult for us. Don't try to contact a particular person that you might know in one hospital. If you have a question, please send it via the appropriate channel so that we can address it in a correct and legal manner. Okay, it's highly appreciated. Another thing, questions that fall outside the scope of the open market consultation may not receive detailed responses. On this, I want to tell you a very practical thing, right? We have been receiving many questions. Thanks for that. We really appreciate the interest. And we are publishing the appropriate responses. But sometimes the questions are not extremely clear. I have a request for you and a recommendation as well. If you see your question answered, but it does not fully address what you meant, please don't be afraid to resubmit your question, further clarifying it, okay? We will reply to it again, and we are not going to be mad or anything about it. We actually appreciate that you are following up on that, because what is not clear for you might not be clear for other suppliers. So please, if you see your question answered and it hasn't been properly addressed because we did not understand it in full, send it again, we will check that again. Another important disclaimer: this consultation is not binding and does not give you or us any kind of right. So it's just information that we are gathering from the market that will be duly considered for our tender requirements. What you're doing is actually helping us understand if what we are asking for is feasible and if we need to fine-tune it, so that in the end we have the best tender possible and we have the best results possible. So you really are helping us to ensure that we can define a solution that is achievable by the market, and also to propose ideas that we might not have even considered because we just don't know. So that's the idea of the open market consultation. And again, very linked to this balance between confidentiality and transparency. We need to be as transparent as possible, meaning we need to publish the information that we receive. In that lines, please don't make this more difficult to us in the sense that do not submit confidential, proprietary, or commercially sensitive information. We are not going to publish if you say that this is confidential, but we will have an issue because we need to be transparent. We will just discard that information. But if you can avoid sending that to us, highly appreciated. The next step in which you will find confidentiality is in the submission of the tender and in the execution of the tender, right? Once we publish the tender documents, you will see that there are actually hard consequences to the breach of confidentiality. In fact, a contract can be terminated if confidentiality is not respected. So I would highly recommend you to check the framework agreement, which is the umbrella contract for the whole PCP, to check your obligations in the sense of confidentiality. Well, to check your obligations and to check our obligations, because of course you are bounded by confidentiality, but so we are. Things that you might find interesting. If the public buyers share confidential information with you about the project, you need to keep it confidential for 4 years. If you share confidential information, or we share confidential information with you in an oral manner, we need to do that by writing in 15 days, okay? Because otherwise, we will try to maintain that as confidential, but we are not legally, nor you, nor us, to keep it confidential. So always, always, always in writing, okay? Of course, if you receive confidential information for the public buyers for the scope of Theresa PCP, do not use it for something else, just for Theresa PCP. If you need to disclose confidential information to your staff, because of course they are working in the project, that's fine. Just make sure that you are sharing that in a need-to-know basis and that your staff is bound to you by a non-disclosure agreement, right? For example, in my contract, I have one of those, so I cannot disclose any confidential information of any project. Just make sure that your staff is also bound by some confidentiality agreements, or otherwise, just make one specifically for this project. And last but not least, confidentiality may cease to apply. So imagine that the public buyers group has shared with you confidential information, and at a certain point, they tell you, no, this is not confidential anymore. You're not bound anymore by the confidentiality obligation. Or, for example, imagine that the public buyer that gave you the confidential information all of a sudden publishes it in their website. It's no longer confidential. And also, we need to be careful about some laws for the European Union of national law that may make confidential aspects not confidential anymore. But we will duly inform you during the execution if that happens. And yes, this is going to be my last slide. Just for you to know, when you submit your proposal, you will have to submit a template explaining how do you propose to address the challenge. In that template, we actually have a section where you indicate which parts of your proposal are confidential. One thing that I will repeat in upcoming information sessions once we publish the tender documents. Do not say that your whole proposal is confidential. That's not allowed, okay? You need to indicate in a brief manner which parts, which sections are confidential, and just maybe state this is confidential because if this information is leaked, this will affect my competitive edge over competitors. And give me reasons for that. What I need you to do is not say everything is confidential because, I mean, the name of your company is not confidential. There are aspects that are not confidential. I need to know exactly what is not confidential. And at the end of each of the phases, you will have to submit an end-of-phase report for you to know. That report is where you're going to explain what you have done in each of the phases and the results. So what were your initial assumptions and what was the end result? The whole document is going to be confidential, just per se, but there will be an abstract where you have to explain the project. And that will not be confidential. It will be clearly marked, but for you to know. Also, this is because of course, we are working with the European Commission as well. We need to ensure transparency, so we are publishing at the end of each phase what has happened in each of the phases. But we give you the right to decide what should be published or not. That's the goal of it. And that's all on my side. If you have questions, of course, I'm going to stay here. I'm going to check now the chat. And again, thank you so much for your attention and for your interest in Theresa PCP. We are really happy to have you here. Thanks.
Thank you, Annabelle. So now it's time for Sophia to explain more in detail what's the OMC scope.
Hello,
Sophia,
good
do you want
morning.
me to share or do you
No,
want?
no, I think
Okay,
it will be
perfect.
easier if I do it. Good morning. Thank you very much to all of you for being here with us. And I will try to explain a little bit more why we are here today. Well, what is an open market consultation and how will be the open market consultation of Teresa? Well, why we have an open market consultation and what it is. The open market consultation is a dialogue between the public buyers and all the supporting entities with the industry. Why we do need this support, this dialogue? Well, the PCP is conceived as R&D competition where the public buyer describe what is the need that they have not for which they have no solution in the market. This need is defined in terms of functionality. This is my problem, and this is and these are the outcomes. These are the result that I would like to have from the solution that I will for which I will pay the development. But we don't know exactly how far the market could reach, could go, because we are thinking now on a problem and on potential solutions that will reach the market not before 5 years from now, 4 or 5 years from now. So we want to develop, we want you to develop solution for us that will be a state of the art within 4 or 5 years. So on one hand, how far you can reach, how much we can ask, and on the other hand, would it be feasible to solve the problem as we are exposing it? So we need to find the balance between expectations and ambition, and to do so, we need to interact with you, researchers, industry, who knows what could be done. We also want to inform you all about what Theresa PCP is. We will likely have lots of candidates participating in our tender. And also, during the OMC, we will, well, the solution, the problem that we are exposing is complex, and we expect that the solution will likely be developed by a team of industries or researchers. So to build this consortia, we facilitate a matchmaking tool that you can use to find your perfect partner for this adventure. Who can join our open market consultation? Well, it is open to all organizations with an interest in wastewater treatment for hospital. But basically, we expect mostly technology provider, industry in all sense, large startups, etc. Also, research institutions, technological center or universities are welcome. And we will also appreciate a lot some feedback from any environmental sector organization or even also other hospital, etc. And obviously, inside the consortium, there is room for coordinator or integrator, some companies knowing the instrument and able to put together all the components that will be needed. This is not And this is not absolutely necessary, but it could be convenient in some cases. So, you supplier, what could you get from participation in this open market consultation? Well, first, you will know firsthand what are the needs and priorities that our group of procurers, our group of buyers, is discussing. You will get update information of how our tender is progressing and how everything will look like. You can get visibility and get known by the rest of the industry and also by the consortium of Theresa. And the most important issue, you can influence the preparation of our tenders. We want to know, we need your feedback to adapt our tender for what is feasible and still ambitious, that's based on the information that you have provided to us. And for procurers, the results that we expect from the open market consultation is to cross-check and clarify if the assumptions that we have discussed and made are rational for our call for tenders, to get some new information that we have not accessed through our markets research, and to create awareness between the community and potential bidders. What are the tools, the mechanism that we will use to engage with you all? Then first we have all these events. We are in the fourth one. In each of these events, we concentrate on a country, and that means that the buyers from this country present some of their characteristics, and also in each of the events we focus on a concrete aspect. Today it has been the legal ethical interoperability aspect that has been presented by Annabelle very clearly, by the way. And in the next one, we will have verification, validation, and exploitation. The final will be a wrap-up event where we will present the results of this dialogue with the industry, with all the conclusion that we got from the open market consultation. Then, what are other mechanisms that we have? In our website, you have the matchmaking tool to create the consortium. You can pitch in our events. You can ask for bilateral meetings. And the most important for us is the questionnaire. I will go on detail on that point. I already mentioned the pitches. I will go to the questionnaire, the matchmaking. We also have in our website the question and answer platform. There we will publish all the questions that we receive by any channel, including those from the events or reaching us by the official email. All these, those that could be made during the bilateral meetings, all the questions will be published and the answer will be the same for any participant in the open market consultation. Now I want to show you our website. When you enter in our website, you can enter to the open market consultation. Here you can find the events, and here you have these two issues, these two parts, the scope and the question. The scope is the document where you can find the descriptions of everything that's concerned Theresa, including the information that we had so far when we wrote it just the day before Christmas. in this, it is very important that you read this document while you fill the questionnaire, because the questions in the questionnaire are linked to the documentation presented in the scope. If you go to the questionnaire, you will find that is built on a tool from the European Commission that is the EU survey. Please don't
Sophia,
panic.
you're not sharing the screen.
Oh, sorry. Thank you, Bartos. And now?
Yes, we can see your
Yes.
screen now. Yeah.
Thank you, thank you. Well, you have to understand mandatory data, which are a few, and after that, please don't panic, because even if the questionnaire is very long, we don't expect you to fill everything. We expect you to fill those sections for which you have relevant information to provide. As I said before, we don't expect that a single company could cover all the whole solution. So we assume that there will be technology components, and if you have, if you are ready to provide more than one technology component, please then fill as many questionnaires as you need to describe them all, and we will put them together later. In case you will find some table like this one, that for contaminant, we really would appreciate if you provide us with this information, that for us is very, very important. But in case you already have this information in a file, please upload it, and we will manage to put the information, to use the information from there. Please, if you think that we have not asked for something that is important, let us know and just answer us to the question that we didn't make. Well, just for finishing this presentation, please be sure that when you finish the questionnaire, you go through this CAPTCHA and you submit properly. Otherwise, we will not receive it. In case you need a template, a Word template to fill the questionnaire with your team, you can use our official email that is in the chat to ask for it. Just to summarize, we need your information to be able to tailor our tender to your reality and to your capacity of development. So please invest some very short time some time in providing us some feedback, and it will be very helpful for us. Thank you very much.
Bartos, is it maybe possible to do the pictures now, because Jan has a telephone he needs to take.
Okay, we can go with the pitches now. So I'm first one, maybe let's see if he's here. Matish from Cerro. Okay, now you have your microphone and your sharing enabled.
I'm here.
So maybe Matish, if you want to share.
Yes, of course. Thank you very much. Just I was not yet prepared for this announcement, so I have to open the pitch quickly. Not a problem, actually, but give me 1 second. Mm. Can you see my screen?
Yes, perfect.
When I change it, you can see the change as well.
Yes.
Okay, perfect. Okay, thank you for the opportunity to have a short pitch. We're very pleased that such a project like Theresa is announced. And on the other hand, also a bit well, excited that I think we can show already quite some solutions that we have developed in the past for filtering at the source, the patient in hospitals. So we're struggling a bit with the TRLs, the technology readiness levels of our current product related to what the Theresa project is aimed for, but I know for sure we can find a solution, and we are hoping to be part of that. Zero is a Dutch-based, so a Netherlands-based water technology firm for healthcare. We are currently an SME scale-up, having 10 people employed, established in 2019, and our mission has always been that we provide smart water technology at the source, so really close to the patients, which is often translated into a toilet or sanitary-based solution with a filter. By means of this, we will reduce medical pollution to water. We recover already and strive for more circularity of raw materials like contrast media, and we have typical solutions for nuclear medicine where there is strong legislation because radioactivity is not supposed to be in the sewage. And by means of our filters, you can easily meet this kind of legislation and you can increase your treatment capacity without harm. But that is something really typical for nuclear medicine. Okay, I don't need to explain what the problem is, but in the end, we can measure everything we take in the water because we excrete via urine. Most of it. So the proposed solution, as we have them now, are point source filter systems. And in some of the solutions, you see it like this. We have filtered toilets, and all of these toilets are contrast media toilets that are put in a disabled or normal toilet room near the radiology department, and we capture both MRI as CT scan, so iodinated and gadolinium-based contrast media out of the excretion by focusing on the urine and by asking a patient to stay 45 minutes in order to excrete 50% of his dose. And the interesting part is that we recover the iodinated and gadolinium-based materials, not to re-inject into the patient, but because the raw materials are precious and we do not need to lose them via dilution in the waters. This is why we take back our filters, we refurbish them, we take out the iodinated and gadolinium-based contrast media and reinstall the filters again. We have a lot of monitoring methods and data on contrast media, but also on our other projects that we have. And here you see a couple of systems, typically the patient-based, but also an ICU pharmacy filter where we process. It's just a small cabinet with a filter and some technology inside where we process catheter bags because people are in many, like the ICU departments, catheterized and they already pee in a bag. So why would you empty that in the sewage? And we were our company actually, the founders of the company were historically involved in building the pharma filter systems, but at the moment we are only servicing one that is still installed in the Netherlands and operational. But our Zero really focus on the point sources where patients excrete in high concentrations and limited volumes the medical residues. And this combination of high concentration and limited volume make us possible to really make systems that fit into a hospital environment. So we already have an install base in Europe and one in Mexico, but that's a little bit opportunistic. The green dots are all nuclear medicine. So our nuclear medicine machines are primarily focusing on the Benelux area, and the blue dots are the contrast media, and the orange are the ICUs. And our expected impact is high efficiency due to high concentration, low volume, minimal interference with other contaminants in our filters. So therefore we have targeted filtration per residue profile, so per department, and we can provide circularity of the filters. And as a result, it's very low in energy use with a compact footprint to non-destructive implementation in the hospital, and in our systems we can measure the impact for influent and effluent. So I hope in the Theresa we can develop and validate next generation configurations, so new application modules for new departments where we're not yet active, and maybe optimize a best fit filtration and monitor per target stream where we're not yet active. So this is actually I think my pitch, because we may be in touch in the future. Thank you very much.
Thank you, Matis. So now let's go with Watopi. So Robert, I'm giving you, I'm enable you a microphone. Tell me if you are here, so I can share your presentation.
Right.
Okay.
Do you hear me?
Yes.
Yeah. Good.
Okay, I'm sharing your presentation. Tell me if you can see
I
it.
can see it. Yeah. Yeah.
Okay.
It's not in presentation mode, but I can see it.
No.
Right. Perfect.
Perfect.
Thank you. Yeah. I just learned about Theresa last Monday, so I'm new in town here. But I have been using your template. We are Watopi. We are a technology and solutions provider, and we also EPC contractor and plant operator. Our mission is, like the other company, to do point source treatment. We do decentralized wastewater treatment, but we do it on a broader scale. And if you want to do decentralized wastewater treatment, you need to have three things in place. The first would be you need to treat to a very high level of cleanliness, hence the name Watopi, Utopian Clean Wastewater. Although we are a young company, we do have a legacy. And please move to the next slide. Right. And some 20 years ago in Denmark, we are situated in Denmark, it was decided to build so-called super hospitals. And at that time, the EPA wrote out to all the mayors and the little communities, well, guys, you have to look into this, because we designate hospitals as point sources that need to clean at the source. Problem was, in 2011, there was no solution, as we also spoke about here. There was no solution, but a team including future Watopi members developed a modular wastewater treatment system, which was implemented in Herlev in Copenhagen. So Watopi members. And speaking of Watopi, next slide, please. I just grabbed some of the text from Theresa PCP and replaced Theresa PCP with Watopi. And I did that because it seems to me that what you want to accomplish in the coming years is what we have already been doing in Denmark for quite some time. So I'm very curious to learn what the difference might be. Our solution is at TRL 9. And so let's have a look at what we actually built. Next slide, please. What you see here is Herlev Hospital in Copenhagen. Already, it was built in the 60s, and already at that time they were quite far ahead because they had the water separation, sewage and rainwater, so they were quite far ahead. And 15 years ago, they started building this wastewater treatment plant. You can see the red circle, and that's actually where the plant is placed. It's there's no smell, there's no noise, and it sits next to a residential area. Right. And by the way, next slide, please. Again, I have been borrowing some of the Theresa text. We do reuse the wastewater. Although we reach a drinking water level, of course, you're not allowed to drink the water. We have been doing it, but you're not allowed to. We use it for irrigation in the surroundings of the hospital and also for technical purposes. You may ask how it works, and please, next slide. These are the treatment steps that we have in the system. We did not invent something new. We didn't introduce a not known treatment step. Our secret sauce is the design and the operation and the process control. So, as I told you, there are 3 factors you need to address if you want to decentralize wastewater treatment. First was you need to reach a high level of cleanliness. Check. The second is you need to be fast, because if you're not fast, you will not have an impact. Next slide, please. This is what we are currently building in Odense, Denmark. And as you see, we had the groundbreaking in March last year. In November, the building was finalized and the machinery as well, so almost. And we are now installing, and we'll be up and running here in spring. So I believe it's okay. But there's also a third factor that you need to take into consideration. Next slide, please. And here you see it's the same plant from a different perspective, taken here in August, I think. It was a slide too far. Thank you. The third factor is it needs to be cheap, because if it's not cheap, it won't be. It won't happen. Sorry to say, it needs to be cheap, because to be sustainable, there's also an economic factor. And making such a plant is actually cheaper than not doing it. It's cheaper than not doing it. And how does it happen? It happens because you don't have to pay connection fees and you don't have to pay discharge fees. Meaning that at the end of the day, if a hospital in Denmark does it, it will have a business case. That was not the main purpose of us doing it, but that's the way it ends up. So to summarize, you need to be cleaner and you need to be faster and you need to be cheaper. And then next slide. I just want to say thank you for listening. That's it.
Thank you so much, Robert, for the presentation. And now we will go with Sergey. So I'm giving you the power to enable the microphone, and I'm sharing your presentation. Okay, I have here. Okay, can you talk, Sergey?
I would if I see my presentation.
Yes, here it is. And the presentation mode is coming right now. Perfect.
Thank you. I was talking about this subject for a few times now at the previous OMC sessions. So this time I would like to focus on a couple of specific issues. So for those who didn't hear this presentation earlier, I shortly say that we are talking about hospital wastewater pre-treatment using non-thermal plasma, also known as pulsed corona discharge plasma, to oxidize organic compounds in the wastewater with high power chemically active oxidants, mostly hydroxyl radicals. At the picture, you may see the reactor chamber in which water is dispersed, or better say, sprinkled with the gravity force through the plasma zone. This is the pilot device of our partner, Vuoksi, Osakehyhtiöt company from Finland, who are producing these pilot devices. Next slide, please. Thank you. I start from the the photo on the left side, in which you may see the hospital wastewater with the sediments. Primary sludge is the term for that also, and the treated wastewater, which was treated in a hard way without particular removal of colloids. So it was treated with pulsed corona discharge, removing the urobilin color and all the pharmaceuticals which were analyzed, like 58 pharmaceuticals, removed by the extent of above 90%. The point, however, of this picture is that the hospital wastewater contains both phases, the liquid and the solid. And if pulsed corona discharge easily oxidizes most of pharmaceuticals in water phase, there is a challenge concerning solid phase, which has to be properly separated and further handled. I have to mention here that, as I already said, pulsed corona discharge works much better if the solid phase, including colloids, is removed. Then we may be happy with a few hundreds of watt-hour per cubic meter of treated water to solve the problem. But also the solid phase problem remains. Please, next slide. At this slide, I actually schematically showed what I already said, that we have hospital wastewater treated down to canalization mains, removing aqueous dissolved pharmaceuticals easily and economically, because pulsed corona discharge showed its energy efficiency exceeding conventional ozonation by the factor from 2 to 10. So we may remove pharmaceuticals from water very effectively, very economically, and very reliably. But with the sludge treatment, all we can provide is the residual ozone for improving its biodegradability and partial removal of medical drugs, but it is not a complete solution of suspended solids. The question is, does the hospital or all the project, let's say, may cope with further disposal of the sludge together with decontaminated water down to municipal wastewater treatment plant, or the hospital, or this, better say, project needs to handle the sludge at the hospital site? This is the question which I would like to raise here. Please, next slide. Thank you. So we need partners. We manage with water easily. We spend very little energy. We make it noise-free, smell-free, and we, parallel with that, we remove not only pharmaceuticals, but definitely all the bacteria and viruses, together with all the genomes or whatever they left in water. This is not a problem. Sludge. So we need someone who will properly handle the sludge and manage it. Another partner who we need for sure is the monitoring of the efficiency. We need to check the contents of residual pharmaceuticals at microgram to nanogram per liter level of concentrations. Technology part is on our side. Instrumental analysis is on a hypothetical partner side. This is the situation. Next slide, please. This is short reminder how the method is working, providing hydroxyl radicals at the surface of droplets, films, and jets of treated sprinkled water in the field of plasma. And this gives us a unique situation when short-living hydroxyl radicals make their job at the surface of treated water. And the lucky coincidence in that is that the majority of complex molecules of pharmaceuticals are also gathered at the surface. So they meet each other in perfect match. So on account of that phenomena, we also win a lot in energy, up to 10 times compared to any other advanced oxidation process, including ozonation. Next slide, please. The experience of the company Vuoksi and ours is in hospital wastewater treatment in Finland. There were two of them. One was the raw wastewater in the town of Lappeenranta, and another was biologically treated wastewater in the city of Espoo, which is next to Helsinki. And these are two different cases with different doses of energy, but both with a very, very positive result. We practically get rid of pharmaceuticals. The TRL6 is, with that, we may consider our technology at its readiness level. At the picture, you can see the pilot device for 2 to 3 kilowatt power of pulse power to treat a few tens of cubic meters of wastewater, dependent per hour or per day, dependent on the concentration of pharmaceuticals. Next slide, please. The results of a few hour, let's say, feature applications are described in scientific publications. One of them is completely new, concerning urine treatment for pharmaceuticals removal, and anyone who wants to read them may contact me. I will send you a copy. And next slide, please. So I already mentioned that the technology provider is the company Voxy, and our university, our laboratory of environmental technology will be a research supporter in this activity. Next slide, please. Thank you for your attention. No more from me.
Okay, thank you, Sergey. So the last one will be Tectero. So I'm giving the power to Melvin, and you tell me if maybe you or anybody else from your team need to do the presentation.
Hello, everyone. I will be doing the presentation. My colleague is next to me. If any questions are needed at the end, but I think it will be sufficient. I can't see my presentation yet. Do I have to present it myself?
As you want. If you want me to share?
I think I can do it.
Perfect.
Can you see the presentation?
Yes.
All right, thank you. My name is Melvin. I'm from the company of Tectero, and I will tell you some more about non-thermal plasma. I want to thank the organization as well for Theresa for this opportunity. So, through the OMC document, I was informed about the current shortcomings in wastewater treatment surrounding these components and other medical related components. And I'm delighted to tell that the non-thermal plasma that we offer has all the possibilities and all the chances to provide a solution in this field. The proposed solution is non-thermal plasma. It is a non-selective destruction process. This means that everything in the water phase can be attacked by our active species. It is the fourth state of matter, for extra explanation, as you saw in the last presentation as well. And it is a proven method for various pharmaceutical and antimicrobial products. We have seen this in our systems before, in the testing that we have done with our government, environmental government, of Belgium. And we have the ability to destruct and mineralize all kinds of POPs, cytostatics, antibiotics, all kinds of bacteria. We have seen it before, X-ray contrast and disinfectants in the water phase. We only need electricity. We don't need any additives. It is completely run on the electricity. And all harmful components are fully destroyed to biodegradable components. We offer containerized mobile and fixed plants. This is mainly because our background is in PFAS remediation and destruction. So we have made these systems for PFAS related and PFAS, in general. We have fully automated systems with flows from the smallest to the highest, whatever the client wants. The expected impacts. We have full destruction potential for various persistent organic pollutants. As we have a background in PFAS, we also monitor all different kinds of organics in our water systems. And we have seen for all of those to go down dramatically. This is why this project is of interest of ours, because we would like to get a more in-depth view of the destruction capabilities of NTP on these kind of medicine. What do we also offer? We have low residence times for these kinds of substances. These kinds of substances, generally speaking, fall in our category of things that we can do with ease without a slight problem. We have a carbon neutral process if renewable energy is used, and we can provide continuous flow equipment with only little requirements and provide compact solutions. We can make these systems to the wishes of the client or the hospital. How is it going to work? Lab scale and pilot testing for targeted compounds in accordance of the needs of clients. We make everything in-house. We are a company that do the research, the designing, and the physical making of our systems, from the electronics to the metal making. So we can make everything in-house and we can do it quickly. The scaling and designing is also part of our team. So everything can be made very fast and without too much delay. We are able to produce a system with the time limits of the project. We have made such systems before, as I said, but we would have to make them, of course, appropriate for the needed compounds. And lastly, our experience in broad range of liquid and gas conversions makes us a strongly adaptable partner, like I said earlier a bit. Thank you. That's it. It was a bit short, but I think that's all that needs to be said in the pitch. Thank you so much. And if you have questions, ask away.
Thank you so much, Melvin. Hopefully we can see you in other events or in the questionnaire. Before finishing, we already have Jan here. Maybe you can do the last part of the presentation about the hospital context, more specifically than it was done in the beginning of the event. So if you want to do it, Jan, I can share the presentation.
Yeah, please do so, Bartos.
Okay.
It's still at high level information, a little bit more information about SAS that might be useful, because I saw in the question and answers that there is indeed more information requested on specifics, characteristics, and we'll see what we can, of course, provide additionally. So if you look at SAS, indeed, at the next slide, you can see the total annual water consumption across all the 17 or 18 locations. So our main campuses, but also the focus clinics. Average daily wastewater flow you can see over there, with an individual campus flow range from 20 cubical meters a day to 250. So that's a wide range. That's why I was telling in the beginning, we're not probably looking with the partners for a general solution. It needs to be adaptable and flexible for the campuses or the locations. So hospital site specialization, multi-campus network, that was clear. That's what I clarified in the beginning. And it depends on the specialty that is provided on the campus, what the impact is on micropollution in the wastewater. It depends definitely. Is there a lot of surgery? Is there dialysis? what kind of disciplines are working on that specific location. And that's also what you see there, wastewater characteristics. There will be some diversity in there. But let's look at that together, what the possibilities are and how we can come to some solutions. So if you go to the next one, it's some more information, Bartos, on ZAS. We believe that, and that's also why we're interested in working together with the partners, that are multi-campus site, and the one hand is providing a lot of complexity, but on the other hand, if it would work for such a network, it will be much more easier to scale, looking at that modularity and adaptability that you see there. What we're already doing, and it's just a short list of some actions ongoing. It's not everything, of course, rainwater separation for reuse, you can see over there. A radioactive wastewater segregation, and that's also obliged, but we still want to uniform this or make it more, do it more in the standardized way. And of course, taking into account the specific context, laws in Belgium. I'm definitely not an expert, but we have experts in our company that can help with this. We would also like to refer to the Flanders Blue Deal on water management, and so there might be some opportunities there to collaborate with some partners that are on the radar within this deal. And we definitely would like to be an early adapter. That's also why we did step into this project. I am fully aware it's at high level. Definitely the figures in the previous slide, the partners will need much more information, and we'll see what we can provide. But it's to give you a little bit more context than just introducing ZAS in the beginning of our presentation. But it already gives you an idea of the amounts, the complexity, but also the opportunities. So Bartos, I think we did prepare this just to give a high-level view, but like I said, more information can be provided. And if you go to the next one, I think that's the last one, goes a little bit deeper to the infrastructure with the diversity that I already mentioned. A lot of discharge points. It's almost similar to the different locations that we have. You see that we have some installations already over there. But again, the main challenge is that we don't have a centralized pre-treatment system. And that's something we would like to discover, if it's needed or not, or if we need flexible solutions on every location. We're looking also to get some more advice, expertise from the different partners in this collaboration network. Like I said, the complexity is a huge challenge, and on the other hand, we have quite old infrastructure. We have a brand new campus. That's then the James Bond of the hospitals that are the president of the board referred to in the beginning, what I mentioned in the beginning. But on the other hand, we also have some buildings historically that already have lasted for a few years. So take into account that outdoor space, we need to see what is available. That modularity would be a strong advantage if that can be provided. We have multiple connection points to the sewer. I talked already about discharge points. We have limited staff at this moment to look at maintenance, because at one hand is the design and to install the installation, but also the maintenance afterwards is also important. Training requirements will be critical, looking what is the support that we can count on externally, internally. Some topics that we're interested to work on together. So that's to give you some idea, and it can also be included in the offers based upon the tender, but some points that are crucial for us to discover and get some answers on that. So I think, Bartos, that was it. I don't think there's an additional slide because this is, again, more towards the general program. Again, more information can be made available, but it's already to give you a little bit of flavor of some of the challenges that we will face together. But let's co-create, co-design, and see what we can do.
Okay, thank you, Jan. So as you can see in the presentation, these are the coming dates, which are important in the PCP about the tender publication. As it was mentioned in the chat, it will be in May 2026, and later the phases. Okay, and we still have one national event hosted by the Maastricht OMC, which will be next Monday, and in February 26, we will have a wrap-up event with more OMC findings about our any kind of question that you may have along this OMC, and we can solve them in the next days. And before we end the event, we have a little question and answer section. Maybe John, do you have the questions by?
Yeah.
Okay,
Thank
perfect.
you, Bartos. Yeah, we have some questions that were provided in the chat. Okay, so we are going to we have try to answer them directly there, but we will do our little recap. Okay, so there was a question that said that the technical characteristics of each hospitals are not included. So, for example, the design flow, the concrete concentrations, special needs, differences between the hospitals and their particularities, and regulations of each country. Also, the locations to install the equipment in each case. As Sophia answered in the chat, okay, we are actually collecting this information. I mean, we did we did start having these discussions about this information from each hospital last month, okay, and we are trying to reach a point where we share some of the needs. This will be addressed in the tender documents, and then afterwards we will also try to have get feedback from you once these these tender documents are published, to try to fine-tune information that you may need. Nevertheless, the information that you already know that you need from us would be really great to if we could know about it. Just try to reach us via the questions email, okay? And this is something that we can take into account, okay? But yeah, this is something that we have in mind actually, and we are trying to provide this information in the future to you, okay? Then we have another question that is more about the procedure of the ONC, okay? There was a question about arranging a meeting to discuss some aspects of the project with a partner or a hospital, okay? Now it's not possible to do that, okay, due to transparency and legal requirements of the OMC process, okay, but it is possible to have this direct feedback differently. I mean, in order to arrange a meeting with the group of public buyers, okay, first you need to fill the questionnaire, and there you can ask for a bilateral meeting, okay, and there we would solve any particular question that you may have. This is a procedure is described in the OMC document, and then this feedback and this flow of information would be made public, okay, due to transparency compliance. Then there was a question about not getting the confirmation of filling the questionnaire. Okay, this is just to remind what Sophie already explained, that it may be because of the CAPTCHA in the last section of the questionnaire. Okay, so please make sure that to complete that. Check that that last bit and know that we need to be rigorous, okay, about these details. And we would also like to add that we ask you quality more than quantity regarding the completion of the questionnaire. Okay, we need to know the information that the more information possible about your solutions. Try to avoid, please, general assessments. Okay, we need things like the removal thresholds that are feasible for our contaminants and so on. So please, yeah, go to the questionnaire, fill it. If you have any problem about it, just let us know, and yeah, that would be our most important way of collecting feedback. Okay, so yeah, please complete it, and as I said before, if there is any problem, just contact us so we can solve the situation and get that very valuable feedback from you. And there is no any other question, Bartos, so that would be it.
Okay, perfect. So I don't know if maybe Gwen or Jan, do you want to say goodbye or something else?
Yes, no, I already sent it in the Q&A over in the chat. So I really appreciate all the efforts, also the pitches. I missed the first one, but I will look at the recording again because I had an urgent call. No, like I said, because there's a lot of information shared, we still need to share still a lot of more technical information. So let's find a way to provide this through the tender and also in the remaining of the program. But let me just thank you, all of you again, also in name of my colleagues at C-level, the board, who are expecting also a lot from this project. So that's some pressure on my side, together with the team here. But we're definitely open to explore, innovate, and contribute to some of the common challenges that we have. I know that's quite short, Bartos, but I think it's already a long session for many people, and a lot of information is already in our head that we need to digest, think about. So looking forward to the next steps.
Fantastic. So we will see you next Monday in the next event, or maybe through the questionnaire or the Q&A. And thank you for coming to this event. Bye.
Bye.
Bye-bye to all of you.
Bye-bye.
Bye. Thank you.